Hey, Mr. Jeffries, my name is Sarah and this is Haley. We're nursing students and we're going to be doing an EKG on you today so we can get an idea of what your heart rhythm is. Is that okay with you? Yes, okay. So we're going to go ahead and get started.
V1 is going to go on the fourth intercostal space on the right sternal border.
3, 4.
V2 is going to go on the fourth intercostal space on the left sternal border.
1, 2, 3, 4.
V3 goes directly between leads 2 and 4. V4 goes in the fifth intercostal space at the mid-clavicular line. V5 goes level with V4 at the anterior axillary line.
Axillary line.
V6 goes level with V5 at the left mid-axillary line directly under the midpoint armpit.
Mid-axillary line.
And now we have the limbs. We're going to do
left arm, right arm,
right arm, right leg,
left leg.
and then there is also something called right-sided 12-lead EKG, and it's just V3, 4, 5, and 6. It's just going to be mirrored to the right side. And some reasons why people might need a right-sided 12-lead EKG is because they can have congenital heart defects or possible acute MI.
So some other tips that you should consider when putting on an EKG is you want to make sure that the patient's chest is completely bare of any hair. Also, you want to make sure if they're diaphoretic that you get a towel and dry them off completely, and you want to make sure that the patient is keeping completely still when performing the tests. Also, you want to keep in mind that if this person has any pacemakers, defibrillators, chest tubes, any central line ports, or any external defibrillator pads, that you don't put the electrodes over those.
Today we are talking about 12-lead EKGs and when to obtain one. If a patient comes in and presents with symptoms such as shortness of breath, dizziness, fatigue, syncope, diaphoresis, weakness, trouble swallowing, paralysis, or impending doom.
Some other symptoms you may see are jaw or neck pain, shoulder pain, stomach pain, and nausea. Some disease processes that could affect perfusion are cardiovascular disease, coronary artery disease, peripheral artery disease, congenital heart defects, hypertension, diabetes, atherosclerosis, and obesity.
And always remember to refer to your hospital policy to know the time frame in which to obtain a 12-lead EKG.
It's important to remember when doing 12-lead EKGs that EKG is a representation of the electrical part of the heart, not the mechanical. So in some instances it may be possible that the heart has an electrical conduction but doesn't have that mechanical capture or the mechanical response. The SA node is firing, telling the heart to beat, but the muscles that myocardium doesn't respond. That may be due to disease or infarction or whatever the case may be.